the School of Public and Community Health Sciences has hired a new program manager. So eventually we will be back to running much much more smoothly. So for folks who don't know, we lost our longtime program manager who, I mean, that was his title, but really cat herder. Like he just kept us going. And now we have a new cat herder. So we're gonna get her up and trained, and these things will be running very smoothly again. Um,
Yeah, we want to say thank you to Carolyn Hester for basically what we're saying, what Damien is, we're all trying to figure out how to do what Patrick did, and if it weren't for Carolyn, we wouldn't be here. So, yeah, it's great. Also Chair Kimber McKay. So thank you to both of them.
All right. Well, with that, we are going to go ahead and get started. We have an invited speaker today that's super excited to hand the Zoom over and let folks meet Lisa and learn about Confluence. So Lisa Dworak is the executive director of Confluence Public Health Alliance, and I know she's going to talk about this, but broadly, Confluence is a coordinating and collaborating umbrella organization for Montana Public Health Association, Montana Environmental Health Association, and the Association of Montana Public Health Officials. And we are so excited that Lisa and Kayla, we've got a team here leading Confluence. And so they're going to talk about that model and what it looks like in practice. So with that, I'm going to hand it over to Lisa.
Okay. Is everyone seeing my presentation? Okay,
Yes.
not my desktop, my messy desktop anymore. Perfect.
Yeah.
As Damien mentioned, my name is Lisa Dworak. I'm the executive director of Confluence, and yes, here with me today is Kayla Chapongian, our operations specialist. And throughout the presentation, Kayla's going to drop some links into the chat that just provide more context to some of the high-level information I'll be sharing. So please feel free to explore the links that she drops in the chat. I'm going to start really briefly just sharing a little bit about myself before I give an overview of Confluence, the programs that are offered through the associations, and the policy work that we work on collectively. And so I'm based here in Missoula, as some of you probably heard, as Damien and James, or Jim, if you go by Jim, were chatting about while everyone was hopping on. I've worked in public health for going on 15 years now, primarily at the local level, doing health promotion, school wellness policy work, healthy built environment pieces. And I actually graduated from the University of Montana as the first student to earn the dual public administration and public health degree in the master's program, and really appreciated everything that Patrick did. So hearing that he's moved on, someone's got some big shoes to fill. And I graduated right at the peak of the pandemic. And so unsurprisingly, my post-graduation plans completely fell through, but I ended up, I think, working with many of you, probably either intimately or more just, in a more like endearing way, collectively, as within the COVID response and incident command system for Missoula County. And so I feel for all of us that went through that. And I primarily worked on communication with stakeholders such as school districts, the hospitals, congregate living centers, and a big part of my job during COVID was overseeing the public health functions within the quarantine and isolation shelter for people experiencing homelessness in Missoula County. And so I share all that because that experience really affirmed my belief that had sort of been building throughout my early career in just how impactful policy is in creating systems that support humans and living dignified lives, both, organizational policies, local policies, and truly state policies, whether it be, policy bills or funding bills. And so just really an interesting experience to bring me to Confluence. And so I've always been interested in policy work, and really am excited about the work that Confluence does. Confluence was established to be the lead public health advocacy organization within the state, and I'll share more about that. And so my hope today is that you'll leave this seminar, which I won't take the whole hour, with an understanding of what Confluence is, and I will have piqued your interest in joining the Montana Public Health Association, and really want you to think about how you fit into public health policy development work and the advocacy work, which will end talking kind of a little bit about the upcoming legislative session. So Confluence is a strategic alliance between Montana's 3 longstanding professional membership based associations that the public and environmental workforce can be a part of. And I have a big star next to MPHA because that's the one that the majority of public health professionals working in Montana can become a member of. And so the Montana Public Health Association is open to individuals, to students, to retirees, to friends of public health, anyone doing public health work. We have a really strong public health nurse section that re-energized after the pandemic. And there's some neat stuff happening within that section, like a mentorship program for public health nurses. There's a lot of professional development opportunities I'll talk about. And then there's a really strong connection to the National American Public Health Association. I know several of you are headed there next week for their big annual conference. And then our other 2 associations that are part of the alliance with MPHA include the Association of Montana Public Health Officials, which we call AMFO. And this is an organization really for the health officers and that lead public health director within each jurisdiction. So Montana is this decentralized public health system, and each county or tribe has a health department or a multi-jurisdictional health department. And so AMFO serves the needs of that top director. And then the Montana Environmental Health Association is really for our health inspectors, or in Montana, we call them registered sanitarians. And they're the ones that go to our licensed establishments and meet with subdivision contractors to make sure that, you know, our environment and food stays healthy for all of us to consume and live in our communities. So that's just a quick overview of the associations. And I'm going to have Kayla drop the link to, and she probably already did it, to the MPHA website. So all of the associations have subpages within our main Confluence website if you're looking for more information. It's really interesting to reflect on the history of Confluence and the associations. And if you're kind of like, I feel like I haven't heard about Confluence, or I've heard about it but don't really know, you know, we're new and there's a lot of work that's happened over the last couple of years, but so much work that still needs to be done to, you know, make our community of professionals, you know, span across the entire state more deeply. But what's really interesting is this history. And so about in 2017, conversations began among public health leaders throughout the state and the Montana Healthcare Foundation. And what they recognized was our public health system really was not in a great place. And so they wanted to identify what did we need to do as a state to have a stronger system. The Healthcare Foundation was investing money locally in CHAWS and CHIPS and strategic plans. You know, they were doing really great grant making work, but yet our system just didn't really seem like it could handle any substantial community health challenges. And leadership was fragmented throughout the state. The system was underfunded, and there was really this lack of understanding of the critical role that public health plays. And so recognition of that led them to do this report. Was very in-depth and very, you know, lots of people were involved in the conversations. And ultimately, they came out with this report with 3 recommendations. The first was to develop a public health institute. And so you can find more about that by going to the Montana Public Health Institute's website. And then the other 2 recommendations are more specific to the membership associations. And it was that we really need these membership associations to be stronger. Their role is unique. Yes, they're nonpartisan, but they can be a voice for health to decision makers when sometimes our members, if they're local government or work at universities, you know, can't always speak for health in that same regard. And so there was just a recognition that the associations had a lot of potential to be stronger. And we really needed to strengthen relationships with our local elected officials, that relationship with commissioners is so critical, with state legislators is so critical to creating a strong system. And so, yes, that report was finished at the end of 2019, and all this work had been done. And then, of course, COVID happened. But what was neat about it is the work had been done, and we had sort of charted the course, even though, you know, these recommendations weren't implemented right away due to the pandemic. A lot of the work was going to launch us well post-pandemic. Okay. And so what came out of the, you know, discussions around strengthening the membership associations was this uniquely Montana solution. It was like, you know, it's really hard running 3 nonprofits and doing so without full-time staff, with board members that have, you know, full plates. All of you work in public health, you know just how demanding your jobs are and how, you know, tired you are at the end of a week. And so we can't really rely on board members and contractors and part-time staff to strengthen these associations. And so the associations agreed that they would come together, they would pool their resources to hire a shared staff and to take on work that was bigger than any one association. And that work really is many things, but I'm primarily talking about the public health advocacy work that needs to happen in this state. And so there was this real, I think, excitement and energy around doing things differently, but at the same time holding on to the core membership of each association and really utilizing board members to be representatives within the Confluence organization as well. So we didn't want to lose that representation that exists, you know, membership being part of the boards. And so we have this uniquely Montana solution that I do just want to share is really been looked at nationally as a neat approach to strengthening, you know, the associations that can do advocacy and policy work differently than other institutions. And so we've had lots of conversations with other states about how we are making this work and what we're learning. And so as you've all gathered, our staff is really small but mighty. It's myself and Kayla. And we do contract with a lobbyist during the session, so we have that support. And we're a 501c3, but 501c3s can lobby, and we do so, you know, in alignment with IRS standards. And then we hire different project leads for different grant projects. And so our current project lead is Todd Harwell. He's a recently retired administrator within the Public Health and Safety Division. And he's bringing decades of experience to this Board of Health project. And so it's allowed us, I think, to really tap into like some experts to do different core programs really well. And then what's really exciting, I think, about our, you know, capacity structure is that we have board members throughout the state. We have members throughout the state, but we also have board members. And so each of these dots represent where board members are. So board members of AMFO, MIHA, and MPHA provide this like just incredible relevance to what's happening on the ground, what their needs are, what they're seeing, what they're hearing, and it's informing the work that we do. And that's how we use board meetings, is to really have conversations with board members about, you know, is our work relevant? What is the workforce? You know, we have all these reports and assessments, but what does that really look like for you? And if your plate is too full to take advantage of a training, like how can we make this, you know, opportunity useful to your team? And so the board members are so critical. And I think it's, even though Kayla and I support 4 boards, I think it is interacting with the board members is one of our favorite parts of the work that we do. Okay, so a few more slides before I'll take a pause. And so as I mentioned earlier, the associations came together in, let's see, 2022. And so we're just coming up on 3 years now. And we really spent that first year continuing to build trust between each other and how we were going to make this uniquely Montana solution work. And we also worked to come up with a mission and vision that we could unify behind. And so you'll see here that we have this strong emphasis on the workforce. And I think that speaks to how much we, you know, hold dearly that membership is the greatest asset to the work that we do. And so the mission, our unified mission, is to unite environmental and public health professionals and amplify their impact on the health of all Montanans. And then our unified vision is that all Montanans are thriving and living in healthier communities because of an innovative, connected, and trusted workforce. And so just really so much, I think, recognition for the work that happens locally and at the state level for members. And so Kayla dropped in the chat our strategic plan. Thanks, Kayla. And out of our unified strategic planning process, our priorities are really to build an organization, right? We're in this intense startup phase. It's messy. We're constantly iterating and improving. And so we have to make sure that we're a stable organization that can sustain itself into the future. We really believe that Confluence is for the members, informed and driven by the members, that we're going to be a trusted source of information, and that we will be a leader in broadening support for the public and environmental health work of members across Montana. So these are not going to happen overnight, but it's really exciting to see all the accomplishments that we've had even in just one short year. Okay, so that's a little bit about Confluence. I'm going to pause for a moment before I talk about some of the programs and ways to get involved. If anyone has any questions or comments.
And so for folks online, if you have a question and you'd like to put it in the chat, you can do that and we can get questions in the chat. Or you can unmute and ask Lisa your question. And again, this is just a pause. She's asking about questions about what she's talked about, and then she's going to go on and talk about the programs and policies.
Just wanted to build myself, a chance to drink some water, catch my breath. Okay, we'll move on. So this presentation, Damien did not invite me to come here and give you a sales pitch about why you should join, but I really do hope you'll see the value in being a part of one of the associations, and the Montana Public Health Association being the most, the one that fits for people. Public health work is really a labor of love. We have lots of passionate, smart people that give a lot of heart to this work. And the MPHA board, they had a retreat last month, and they really recognized this. Like, we can provide this sense of support. We can be, that people need this sense of support and this connection as we work to improve the health outcomes for the people that we're serving. Membership also includes scholarship opportunities, professional development. And then, one item we hear often is that people really value knowing that there's an organization that's making sure decisions happening in Helena, both during the legislative session and during the interim, work for public health. And so it's really hard to follow that stuff during the session. It moves really quickly. And then the work doesn't stop when the session's over. And so that, knowing that an organization is tracking the policy and is hiring a lobbyist and, is alerting people, and work that will only continue to get more adept at, is of huge value. And so the way to support that work is by being a member of MPHA. So I'm going to share a little bit more now. Other exciting things that happen throughout the year to connect with your peers, those across the state, grow professionally, is our annual conference. And so MPHA and MIHA have done this joint conference for a long time, but when Confluence was formed, all three associations really do come together to put on this statewide public and environmental health conference. And so we are gearing up for Confluence 2025, which will be in Helena in April. And our theme this year is building trust and talking health in a changing world. And there's many ways to get involved. We'll open up the abstract application, and that will include for breakout sessions and poster sessions. Last year we had over 50 breakout sessions and over 250 people attend. Wellness was offered thanks to the Wellness Center. And we've done mobile tours. There's lots of networking and socials. And so it's a really neat opportunity to connect with people face to face, and to energize around the work that we do. We also are looking for folks to help us create a meaningful conference by serving on the planning committee. And so they meet monthly right now and really just help make the conference a really meaningful and engaging experience. So please consider joining our planning efforts. Okay, and another really neat resource I want to make sure people know about, because I didn't know about this when I was working in COVID response. And I remember interviewing for this job, and the person interviewing me said, "Oh, you probably use Connected Community." And I said, "No, that would have been so great if I had known about it." But we were all had our heads down and were working so frantically. Um, so Connected Community is this really neat online community platform. It's a place for professionals to connect and collaborate with each other. There are over 30 topical communities for individuals to connect on, and you can create your own community. So if there's one that you're not seeing, likely someone else also wants to engage in that topic, and we can create a community around that. And so a couple examples of the communities that exist right now include one for epidemiologists, one focused on health equity. There's a community health worker partnership group, infection control and prevention specialists, emergency preparedness, lots of communities. So I encourage you to check it out. You just go, you log in or create an account, and it does have to get approved, but it gets approved pretty quickly. So I would invite you all to join Connected Community. And then a really exciting professional development opportunity that we get to offer through the associations with our workforce development contract from the state health department is scholarships, all expenses paid to attend national conferences. And so what we hear about this opportunity is that members feel like it energizes them. It's a great way to retain staff. You know, a lot of times you just can't afford to send someone to a national conference, right? And so this is just a neat way for people to experience things nationally and bring it back to the state. And we get lots of good ideas that help shape our Montana conference. And so we typically send people to the American Public Health Association conference. I think I saw B-Rad on here, and he is going next week, I think, as a APHA recipient of this award. And then NACCHO, the National Environmental Health Association, and we had a group go to the Board of Health conference in August. So really neat. Okay. And the best way to hear about all these opportunities is, of course, our website, but also our monthly newsletter. And so this goes out like second, third week of the month. Somehow it's already October 21st, and it'll be going out this week. We don't have a social media presence yet. I'm sure we will at some point. And so this newsletter is really how you learn about what's going on, scholarships available to attend conferences, and just ways to get involved. I think too, so I just pulled some images from newsletters in the last month or two, and we also share things that are happening nationally that sometimes, you know, like this example here is from APHA, and you can apply as an individual or nominate someone to get an award. And so our lives are just busy, and we get bombarded with email. And so we really try to, you know, compile everything that we see that I think would be relevant to members into this monthly newsletter. And then the MPHA board, this picture is just fun. We had a board retreat last month, and they're just really excited and they're really energized, and they really are looking for ways to foster connection and support and, you know, strengthen MPHA after COVID and after this big transition with Confluence. And so we've been through a couple of really transitional years, and they have some really great ideas for the new year, how to connect with members. So it's a really neat time to get involved. And I want to invite everyone to the MPHA annual member and non-member business meeting. I'm pretty sure it's going to be Thursday, December 12th. We were trying to confirm with our MPHA president before this presentation. And so that'll happen, you know, December 11th or December 12th. And so it'd be a great time to come learn more specifics about, you know, the session as we head into the legislative session, and some more conference specifics. So please consider joining us, and we'll post the Zoom registration on Connected Community and on our website, and it'll be in the monthly newsletters leading up to the meeting. And then we have a member survey, and as soon as I said member survey, it really is a non-member survey. We want to hear what people are looking for from a membership association. And so please do complete that survey. Tell us what you think, what you want from the Montana Public Health Association. And so that's just an overview of some of the programs and, exciting events that happen throughout the year for members and non-members. Any questions before I talk about some policy pieces? Okay. Okay, I have to take a deep breath here because every day the legislative session is getting closer and closer. And the days are getting shorter and shorter. I'm like, how does that happen? So, as I mentioned, Confluence really is intended to be the lead public health advocacy organization. And we are still small and we're still new. And this is only our second session. But what I really want folks to think about is your role in policy development and program planning. And so we have these core competencies, that are knowledge and skills that the workforce, no matter what you're doing within the field, the entire workforce needs to deliver the essential public health services and ultimately improve health outcomes for the people that we're serving. Also, what's really interesting is the Montana Public Health Workforce Assessment was completed in 2022, and it's a statewide survey of public health professionals and competencies. And what came out of that assessment is they identified policy development and program planning as one of the top 4 priority areas that the Montana workforce needs more training and education on. And what was really interesting is there was a need for more training, but there was also a strong interest in getting more training there. And so I think people are really recognizing that they have a role in this and they want to know how to best, best work on policy, given the hat that they're wearing. And so I just start with this because I think it's really critical whether you're a practitioner, a student, a professor, a researcher, there's a role within the policy work for you. So I always come back to this definition of public health advocacy, and this definition comes from the Network for Public Health Law. And the network defines public health advocacy as building support for a strong public health system that promotes health outcomes for all, especially those that need it most, by working with community partners, drawing on a full array of advocacy tools, mobilizing individuals to support, protect, defend the authority and the work that the organizations do across the entire public health system so we can bring about social change, population level change on behalf of, our health goals, programs, interests, populations. And I just love this definition because it's so big, so broad. And so I think all of us can see ourselves in it in some way. And I think too, it really demonstrates how public health advocacy is critical to the work that we do. And whether or not we realize it, we might be doing some type of advocacy work already. And that you're really critical, likely in the work that you're doing to supporting public health advocacy. And so I just think it just feels really relevant no matter where you are in your public health career, journey, or practice. And these dots here are meant to show that this work happens outside of Helena, outside of the Capitol. It happens in our communities, in our coalition meetings, in the classroom. And Montana has this really interesting biennium legislature. And so our legislature meets in odd years for 90 days. And so during the session, during that 90 days, so for us in 2025, it'll start on January 6th and end mid-May, pretty much everything is lobbying, right? There's a lot of, we're talking about specific bills. We want people to support or oppose them. But outside of the legislative session, everything is education, everything is relationship building, everything is advocacy, and it's building support for the work that we do through utilizing facts, providing research and evidence, telling stories, talking about, the impact that we're having. And so that's why public health advocacy and education is so impactful and happens the majority of the time. Okay. And so I'm really not going to get into what is lobbying, but I just want to emphasize that lobbying is something very specific. It's one advocacy tool, and we have many, many tools to create support for the work that we do. And so the legislative interim is a really beautiful time. And then even during the legislative session, there's still ways to be engaged, even if you can't lobby. And that's why you join an association like MPHA and you support Confluence, because we will make sure someone's lobbying for those important policies. And so you can always, ask yourself questions like, what hat am I wearing? Can I act as an MPHA member? What constitutes lobbying? What can I do? What am I restricted from doing? And we usually have a more in-depth member webinar probably in December that will go over this a little bit more. So keep your eyes peeled if this is interested to you, or reach out to myself or Kayla and we can talk more. And so I just kind of wanted to demonstrate how we do our public health advocacy work in Montana. Again, emphasis on Confluence is 3 years old. Really excited about where we're going, but this is all still new and we're still building a lot here. So Confluence is really focused on defending and advancing public health policies through a political environment. And so policy analysis is really important, but guess what? You got to get through a political environment. And we have this incredible asset in our membership, which is why I'm so excited that I get to talk to 20 or so people about why they should be a member, because the more members we have, the more connection we have to, a web of folks that can support public health. And so we have this really great grassroots base through our membership throughout Montana. We utilize a policy and advocacy committee that includes representation. And so if you're really interested in this work, or you want to, work more closely with it, please join our committee. You don't have to have decades of experience to be on the committee. And I think Kayla will drop that link in the chat as well. And this committee does a really great job of looking at the bills that are happening during the session or what's happening during the interim, and identifying what we need to weigh in on, what our story is, what our message is. If we need to, pull in different members to talk to different legislators, they really help us with that strategy piece also. And then we, of course, cannot do this work alone. Unsurprisingly, public health is not the one that's always taken the most seriously or the most trusted at this point. And I think we're rebuilding there, but we work with a lot of really great partners and in coalitions. And so Montana Families for Vaccines, the Alliance for Healthy Montana are two of our, closest coalitions that we work with. And then a number of really great partners. The Montana Association of Counties is a really critical partner to the work that we do for Board of Health and Public Health Authority, and then a variety of others. And then also through our connections with the state associations, we have really great pipeline to technical assistance at the national level. And then talk about this in my next slide a little bit more, but really working to leverage relationships that people have, knowing that, again, sometimes someone else is a better messenger and can speak differently about issues than we can as public health. And so this Friends of Public Health is a really important piece also. And those are all the levers that we work within and sort of pull differently depending on the need throughout the session and the interim. And so really how we do this and how we had success in 2023 legislative session was really through this idea of a network, or what we call power mapping. And so power mapping is essentially identifying who has, influence and who has power, and connecting those two to get what you want or get what you need done to support public health policies or defend public health policies. And Montana is this relationship-based political operative. And so yes, facts matter, of course, but the messenger and the relationship really do matter most. This is a long game, right? Rebuilding trust in public health and developing a network of people to speak for public health is a long game, but it's working. And there's a lot of opportunity to bring people, legislators, and public health closer together on issues when we approach it from a trusting relationship. And so we have to utilize this really grassroots relationship-based approach to holding legislators accountable and building support for the work that public health does. I think that accountability piece is really key. What we saw in 2023 on a couple of key issues related to, a bill that was trying to defund tobacco prevention specialists. There were some really nuanced land use pieces that the sanitarians dealt with. There was some immunization items, was that when we could get a trusted person to talk to a legislator and then bring in comment that held them accountable to their constituents, that vote was challenging for them to vote yes or no. And we had some success in getting votes that way. So I'm really excited about this. It feels really strategic. And again, our membership is such an asset to the state level policy work. Let's skip that slide. And so I just wanted to share our 2025 legislative priorities. Unsurprisingly, public health is very broad, and therefore these priority areas try to kind of cover everything while also providing us some direction. So, of course, we'll be tracking the budget committees and ensuring that there's funding for public health services. What we see a lot of in public health are bills that say, public health must perform this inspection, or complaints can be given to the public health department if someone violates this, but there's no funding for it, right? And so there's a lot of unfunded mandates for public health programs and services. And so we keep an eye out for that. One piece that's going to be really interesting is the Montana Environmental Health Association and Confluence are bringing a proactive bill, legislation to adjust license establishment fees. And so when our health inspectors go into a restaurant or a spa or a pool or a hotel and perform those inspections, the fee is not covering the cost of that inspection program. And there's a huge reliance on taxpayers to perform these health inspections. And so we're trying to bring, the funding split between taxpayers and operators a little bit more closer to the middle. And so that'll be interesting, given what's going on politically right now. Apologies. Public Health Authority. So in the 2021 legislative session, there was definitely, really sharp reaction to what happened during COVID, and Public Health Authority got hit hard in that session. We've made some inroads, and so we're not seeing as much Public Health Authority or challenges to Public Health Authority, but continue to make sure that the authority of local boards of health and health officers to address, issues of importance within their communities remains intact. Immunization. So for those of you that have been following the immunization policy landscape in Montana, there's a real relentless effort to provide for non-medical, so religious or personal belief, exemptions within licensed childcares. And we know that we need high vaccination rates to keep our most vulnerable populations protected from vaccine preventable diseases. So that continues to be a big issue. If you're interested in vaccines, I would really encourage you to connect with the Montana Families for Vaccines. They're doing great work, and we're part of their steering committee and really look to them to be a leader in that space. And then health promotion, environmental health. So we have to make sure that our Clean Indoor Air Act, remains intact. And there's just these undercurrents of public health that people take for granted that come up every session. Behavioral health prevention. So in 2023, $300 million was invested in the behavioral health system. And an interim commission was really tasked with identifying recommendations for how to create a system that gets communities out of crisis. As public health, we know that we need to be prevention focused here, but there's really not funding for prevention. And so how do we get upstream of this crisis within communities? And so we always see bills around that. And then Medicaid expansion will be sunsetting. And so we'll be a me too in that effort, but recognizing how important it is that, 80,000 Montanans remain or keep their health insurance. And so those are our legislative priorities going into this session. But our big focus will definitely be on that license establishment fee adjustment bill, and then immunizations will likely be a big item for us as well. So just want to encourage you to stay connected. If anything sounded interesting to you, join our legislative committee, become a member, learn more at the business meeting. We'll have a legislative kickoff in January where we'll kind of run through everything more specifically and ways to remain involved and get alerts. Every week during the session, the environmental health updates are on Fridays at noon and the public health updates are on Thursdays at noon. And this is like a 30-minute Zoom call where we just talk through what's going on and get ideas and feedback from people. Please attend the conference. We'd love to see you there. Encourage you to submit posters or breakout sessions. And then, of course, go check out Connected Community. Let's skip that slide. I've already talked about that one. And that's everything. So thank you for listening to all of that. And thank you, Damien, for having us. And I'm happy to answer any questions. So.
Yeah, thank you, Lisa and Kayla, for being here. So, online applause, virtual applause for Lisa and Kayla. And so, questions, follow-up, thoughts, ideas based on the information that Lisa shared with us today. Please feel free to unmute and ask, or you can put a question in the chat, and we will make sure that it gets asked. And so, Lisa, I can't remember, will Montana Public Health Association be hosting anything at APHA this year?
They are meeting up for dinner.
Okay.
Yeah, maybe Kayla, we can connect Damien and others that are attending there.
Yeah, so if folks, are attending APHA, you want to, sort of get more involved with the Montana Coalition, look for us in Minneapolis. I'm so excited that APHA is in Minneapolis because we can have a direct flight. So
yeah.
Questions for Lisa and Kayla on Confluence Public Health Alliance?
And I would just really ask those of you that are going to APHA, if you see a topic or a speaker that you thought was incredible and needs to be brought back to Montana, send Kayla or myself an email. Really, we utilize those national conferences to help inform some of what happens at our state conference. And I would encourage those of you presenting to think about presenting at the Montana conference in April. Thanks, Damien.
And for those who maybe don't have the Montana conference on your radar yet, I will share that last year it was here in Missoula, and Ella Morton Green, who is the president of the American Public Health Association, came, and I got a chance to meet with her both there and then because I'm involved in my APHA section later. And she said that was one of the best statewide public health conferences that she'd been to. So we have it right here in our back door. So 2025, it's going to be in Helena. Right? I don't think I misspoke. I'm pretty sure it's in Helena. So feel free to join us at the Confluence conference in April. All right, Lisa or Jim, go for it.
I have a quick question before we go. Lisa, as a student of organizational leadership and someone that's worked in organizations for a long time, what was the trick to get everyone to play well together? Can you give us any nuggets there?
That's a really great question. And I was brought in after everyone had agreed to coming together. So I'd be curious to ask someone that really got them to all agree to that. But I think, there is a couple of things that everyone came to the table with was this idea that rising tides do help all ships. And like the organizations were had varying strengths. And some of them just really knew that they needed each other to stay afloat. And so it's really hard to run a nonprofit. I also think one piece that's gotten everyone to stick and really believe in Confluence is showing the successes and demonstrating that this thing is working. And we have a lot of pieces to demonstrate that. And so just continuing to really work towards communicating the success that's happening has been really helpful.
That's so awesome. I mean, as a social worker, I can say that, we have the Society for Social Work Research, we have the Council on Social Work Education, we have the National Association of Social Workers. And for the nearly 30 years I've been involved as being a social worker, 25, I can say that we've had so many conversations about combining conferences, how it's not happening. So yay, public health. That's pretty cool. And other organizations that are involved in Confluence. Thank you.
All right. Well, thank you, Lisa and Kayla, for joining us today. And I didn't pull it up ahead of time. Jim, do you remember what is on the deck for next week?
I did look and I can't still remember. So yes.
I think it's AI with Steve
Oh,
Schmidt.
AI with Steve. All right.
Yeah.
Lisa got, yeah, that's also a great. So please join us next week. We'll be discussing artificial intelligence in public health. And thank you again, Lisa and Kayla, for being here. So have a great Monday afternoon, everybody.